I'm going to be telling you a couple of things about log rolling, the hotline, and this lovely C-color. And this is one of my models. And tell me what's wrong with this picture.
The collar doesn't fit right.
Okay.
It's even on.
And it's lined up incorrectly.
Yes, and
And she's a pillow under her head.
that's a no-no, right?
Yeah,
Okay.
no railings.
Okay. Well, yeah, the
She doesn't
railing.
have a patient ID band.
Okay, that's good. Okay, that's good. You're right.
Promise.
So, number one, no pillow allowed. And number two, it doesn't look like it's on right. Okay. So let's see here.
So do you want me to hold her while you redo the collar?
Yeah, so this is the Miami J color. And one of the most important things is, when do we consider putting the C color, changing it from the Philly color to the Miami J?
We know we're going to be in it for more than 24 hours.
48 hours. If we know it's more than 48 hours, okay? And the sizing is important. We don't really go by big, fat, large, etc., small, medium, large. We go more by the distance from the shoulder to the jawline. Most American males use a stout, which means they are shorter from here to there, and most American females have a longer neck, so that's more like a medium, okay? And yes, I need your help. If somebody can hold proper C-spine precautions. Okay, number one, when you do C-spine precautions, you want to stabilize the C-spine with the rest of the spine, and if you just hold the ears, you are not really securing.
And you're not in, keep coming.
So let me show you something. Put your thumbs on her shoulders. So you basically, and now you're stabilizing her C-spine with the wrist by your ears. Okay, so now when you're turning side to side, for example, you know, you can, yeah, but that's for holding C-spine precautions. But when, now you got to back off a little bit because no, go ahead, just because now I have to put that C color on. There we go. Now where's up and where's down? No, this is the front. It says front on here.
So it'll say front and then the arrow's pointing up, so you know that you've got the front of the collar and you want the top of the collar being facing up.
Right, so that would be the front and arrows up. And then this is the back. And again, you look at the arrows and it shows up, so that means this is up. Okay, and then you're holding the C-spine precaution. To back up a little bit so I can actually get under there. There we go. There we go. Hold her. There we go. And then you put it on there. There we go. There's a little Velcro tabs. And again, arrows up. Now this little gadget here, this little extra pillow, we use when the patient is sitting in a chair. Thank you. Okay, but when they're just in bed, we don't need that. And there's a couple of different things. We're supposed to put it on and under so it fits better. Okay, and then you do the blue Velcro tabs on the blue Velcro. Many people, they just hold C-spine again. They just kind of slap it on like that, and then if the Velcro is not matching up properly, then you know there's a problem with it. Okay, let's try this again. There we go. And you always want the soft pads on the skin. So make sure that the skin is protected by the soft blue pads. There we go. How's that? Is that too tight?
Actually, it's perfect.
Okay, very good. What else need to tell you about it? So you wash these, you can let go now, thank you. You wash these pads once a day, so every 24 hours, and you assess the skin underneath every 12 hours. So you have to have another person and log roll the patient and take this apart. And the Velcro, these little pads are Velcroed, so they are adjustable. Many times I find patients that where the white plastic is just digging into their skin because the black Velcro part, the blue cushion is not underneath enough, okay? Alrighty. What did I forget? Anything that I need to add that you guys remember? Front, back, adjustable wash. Oh, okay. One more thing before we go into the turning itself. What is this thing for? Have you guys seen it before?
They're gonna be in bed for a long time.
Right. If they have,
acceptable region.
yeah. If they have like a boggy head, or you're afraid of skin breakdown. So of course, again, where's up and where's down? I would imagine you look at the writing. That gives you a clue. And again, this comes off. You position it on there with the Velcro tab so the skin is protected from the plastic edge, and you ought to wipe it down on your sit at least once and assess it. Okay, so who can help turn? Let me see, we're going to do a full spine turn. I guess I need everybody.
Do you need my hands too?
We need 2 people on either side.
No, let me see.
For a full spine?
That's right.
For full spine.
2 on one side, yeah. You and then us, right? Okay, so we already went over how to position your hands. So you put your, right like this. Okay, and then what are we doing?
We're gonna crisscross, so I'll go like this and you'll go over
Okay.
top.
Can you put your hands over your chest, madam? We're gonna log roll you, don't help, and we're gonna log roll you to the left. So shoulder, here and here. I'm gonna crisscross. And break is on. Good, and you count.
1, 2, 3.
Good. Okay, and then whatever we need to do, fix the pillows, turn, assess the skin, and then when we're ready to go,
1,
down.
2, 3.
Okay.
And then you assess for also no wiggle the fingers sometimes.
Good. Yeah. Oh, make sure we're still
Still functioning.
How did that
okay.
feel, Joe?
It felt very, very wonderful. I felt like I was kept in a straight anatomical
Okay,
position
wonderful.
during the whole turn.
Okay, we just, we're a little behind schedule, we gotta keep moving. So, thank you very much.
You're welcome, thank you.
Can I remove the collar?
Yes, please.
Permission to remove collar?
Yes,
There you go.
okay.
And you can lift your head.
Okay, I've been
Yeah,
cleared.
Because you've been cleared.
I see
I just
my
cleared you.
Okay, and I borrowed this handy dandy little chart from the unit that talks about the sizes again. And like I said, stout is mostly for American male, and it measures the distance from your shoulder to your jawline there. And it actually has its own set of little pillows and little Velcro cushy things. Okay, I don't know if you have this on your floor, but
We do,
this is
yeah.
always helpful to use. Okay, then next is the hotline. It comes in this kind of a package if you're looking for it. It's a carton. This one is already torn apart, and we use it for patients that are really cold or we expect them to be cold, where you have to set it up for CVVHD. Have you worked with it? Have you worked with it at all?
I've been trained on it in the past.
Okay, very good, very good. So this is the new and improved upgraded hotline fluid warmer. First, we plug it in. We turn it on. We kind of check real quick if there's actually water in it. There's a minimum and a maximum level. And I guess that is the minimum level and this is the maximum level. I have no idea why it's beeping right now. It says 20 degrees, disposable. And water. Okay, I'll have to ignore that for a minute. So, I just have a set flushed here. So, basically how this works is once, it's just an extra little tubing here. It's actually an IV tubing surrounded by another plastic lumen. And once you click this in here, the water is allowed to go around the tubing and circulate. So once you pull this back out, no water squirts out, and even if you disconnect this and cap it, no water will squirt out here, extra water that warms it up. Okay, so you click this in somehow. That's practiced. Okay, and there's already water in here. Wow, already. Now, now you just take your regular tubing and you attach it to this one. For some reason I want to clamp it. There we go. Without touching the edges, of course, here. A little sloppy. There we go. So now the fluid once I open this up here, let me see. Then I open it up here, it should just. And unclamp one more, very good. It should just come out here, nice and toasty warm. There, I see it go. Oh yeah, nice and warm.
What are the temperature settings?
It's at 20 and it's automatically,
It's automatically preset.
yeah. Oh, actually, it went up to 26. Beautiful. It might, I don't know what the maximum is, I have to be honest with you, when I just looked it was 20. So I think it's just still warming up.
And will it max at a certain point so that it won't get too hot? Okay.
I think it's all already organized in that pump, it's already programmed.
So you just hook it up and go.
Hook it up and go. And then when you think you don't need it anymore, what do you have to do, or what do you think you need to do?
Clamp all of your tubing first.
Okay,
And then you just said you pop it right, you push those two levers together to release it from the machine.
no, it's not supposed to leak.
Oh.
It's not supposed to leak, and then you can just continue using this till you have to change the tubing. Okay, there.
Now is that's obviously per patient use that tubing?
Yeah, it's a disposable one.
And is it a one-time only or can you reuse this part of the tubing?
I would imagine it has the same expiration date than a regular IV tubing, and I just got doused.
It applies totally.
She took a shower. At least it was warm.
That's so good.
Okay. Alrighty. Does anybody want to play with this and just feel how it goes in and goes out?
Today, thanks.
Be
You know, I'm
careful that you
wondering
don't slip and fall.
So you push it there, and so there's nothing here to really clamp to keep it from doing any kind of leaking, really.
Yeah, so you're supposed, it's supposed to just seal itself off. So you, have a towel?
No, that's what I was just asking about.
Well, I think there was probably just some in there, so you take it out and it's not supposed to squirt at you.
Right, it's not, that was the whole redesign reason.
Maybe you just need to turn it off before you pull it out? Did I turn it off before I?
No.
No, okay. So maybe that's the trick. Turn it off before you pull it out.
But there are no arrows to adjust the settings for the temperature, or just,
No, it's all preset. It's factory preset, just like,
That's what it's.
the blanket, not like the bear huggers, they're all, well, you have an adjustment there.
My understanding is the biggest thing to watch for is the water line, because even just now it drops significantly from when we first turned it on, so we just want to make sure
Yeah.
that is full.
Yeah, and I think usually you don't, the water will go into the tubing and be in the tubing, but then I lost some extra, and that came out. I think the trick is to turn the machine off before you unplug it.
Yep.
Yeah, and I don't think I did that.
Now we know.
I don't think I'll forget that one. Okay, I think, does anybody have any questions? Do you guys want to just do hands-on and pull it in and out? I think it's fine now. There's no more water coming at you.
Jump on in.
it's pretty self-explanatory.
And do you understand the system?
I've done it before.
Yeah, I was gonna say, you're more likely to need to do it. There's some papers on it.
Actually, no. Yeah,
Popped out.
yeah, yeah.
Just make sure the machine is off before I pull it out. which is a
Yeah,
valid
see,
lesson.
we're all learning from that. Yeah, I think we're done.
Okay,
Thank you.
so,